So I would now like to introduce Bianca, who will be sharing her story with us this afternoon. So thank you so much for coming along, Bianca, and sharing your experience. As I'm sure some of you guys have experienced, Bianca's been a little bit caught up with public transport this afternoon as well, which certainly makes me feel very, very stressed. So we do very much appreciate you coming in.
Thank you.
So I've prepared a few questions for you, Bianca. So I was hoping that I might just ask, and it'll be a sort of less formal interview, and then the students will be writing some comments and questions as they go, and then Lefteris will collate those questions, and they'll have an opportunity for you to respond to those as well.
Sounds good.
Yeah. So just to start with, are you able to briefly describe the circumstances that led you to seek the services of a counsellor?
Yeah, so basically I was around 15 years old, so it was during school, so I have a pretty good memory of kind of that time. So in family life, basically parents going through a divorce and other family members going through other mental health issues. So around that time everything was quite overwhelming. On top of that, having school and just like the pressures of daily life, basically. So it all became pretty overwhelming. So everything that I guess you mentioned in terms of what anxiety is what I experienced, basically. So a lot of insomnia, a lot of distress and stress. So basically, I took a day off school, and my dad just took me out to kind of just relax. And then after that, they said, maybe you should talk to a doctor about this, and did kind of that test with the doctor, I think it's the mental health test, and they put me through to a counsellor, so for some therapy. So so I was also kind of having panic attacks and things like that.
At the time as
well?
At
the time, so it kind of all kind of pushed to get some help. So
So it sounds like there's a lot of different things that were happening all at once. For you.
So it was around that age.
Okay. Thank you. And you've sort of described a little bit already, but are you able to sort of go into a little bit more detail in terms of what the experience of anxiety was like for you?
Yeah, definitely. Like I said, like how you just mentioned, all of those things, even just saying it, I can remember certain times when I've had those experiences. So, excessive, like even sweating during when like you've had a part-time job, and just things are so stressful, and, insomnia, and just like a fast, heartbeat, and panic attacks, and things like that, like lack of appetite, and these kind of things. I'd say it's, to describe it, it's just kind of going from like a normal state to when it's really bad, it's just kind of going down like a negative spiral thought process, and it's something that you can get so wound up that you feel like you don't have any control over. It's very hard to kind of snap out of that, and it can be really debilitating.
Okay. And what about when you're experiencing panic? Were you able to sort of share a little bit about what that experience was like?
Yeah, definitely. I guess I can remember a few different panic attacks and times that kind of happened. So I would say it's just where, you're breathing, your heart rate goes really fast, and it's something that, like I said, it feels like you've got no control. So it's basically like a hyperventilating, because it's just kind of like your body's just kind of reacted, and it's a feeling of being petrified. It's probably the equivalent to that really strong feeling of fear, like you kind of have mentioned. It's like that.
And how long did they last for?
They kind of varied. So I remember I used to kind of have ones that probably went for about like 20 minutes or something. So eventually kind of got through a way of being able to calm down quicker and focus more on your breath and things like that. So,
Okay.
yeah.
Wow, and did that sort of tend to reduce the length of the panic
Definitely.
and how frequently they were happening?
Definitely
Yeah,
did.
okay,
Yeah,
okay.
definitely. So just being able to realize, like, you know, you are kind of more in control of your thoughts and your breathing, rather than coming from a mindset of, you know, that you have no control over it and it just takes over.
Yeah, okay.
Yeah.
And so you were 15 where
Yeah.
everything just all came to a head, it sounds like, and you
Yeah.
had a day off with your dad and then
Yeah.
went to the GP and
Yeah.
was referred to a counsellor.
Yep.
Do you remember what your first impression was of seeing the counsellor?
Yeah, she was really good. So I was really lucky. I had a really good family doctor. First of all, she was, you know, really supportive about it all, and put me forward to someone who was. She was just really lovely. She was very warm, very welcoming, very kind of authentic, and she was really great.
Okay.
Yeah.
Okay. Was it a scary sort of experiencing the counsellor for the first time, or did you sort of know what to expect? Or?
Well, having no idea kind of what to expect,
Okay.
especially at that age too. I think it comes with a lot of, it's kind of not embarrassment, but maybe a bit of shame or
Okay.
something, a bit of about the whole experience, and kind of just going through, like, you know, you don't think you're normal, you think there's something wrong with you.
Okay.
And then talking that out with a new counsellor and, you know, her going through what anxiety is and this is all, you know, it's part of the disorder and things like that.
Okay, thank you. And something that we speak about in the recorded lecture is, you know, really normalising the experience of anxiety, and also you're probably familiar with this term psychoeducation, of, you know, providing information about what anxiety is and, you know, why it is that you're feeling certain ways. So it sounds like for you that was quite a sort of empowering part of your counselling, is that?
Yeah, definitely. I think that that whole kind of piece on education and things like that really helped as well. Because at the time, you know, they diagnosed me with generalized anxiety disorder, and I was kind of like, what is this? You know, like it sounds really bad, but you know, talk through what it was, and it definitely helped.
Yeah. So are you able to sort of describe a little bit about what your understanding of generalised anxiety disorder is?
Yeah, I can probably touch on it a bit. So I guess it's just, I guess what you mentioned, that excess kind of worry with kind of everyday life. And what I've found as well, it's dependent a lot on situational.
Okay.
So I find that a lot of, you know, high pressure kind of situations do kind of provoke the anxiety and things like that. But from my understanding, it's something that it's excessive worry, kind of all of the time. And just over the years, been able to kind of self-manage, and it's really increased, my way of life, and it's been a lot better.
Thank you so much. And we have, you know, gone off a little bit from the questions provided, so thank you. I really do appreciate you
that's okay.
speaking to those points. You've mentioned, you know, again a little bit about this, but are you able to identify any aspects of counselling or the counselling process in particular that you found useful?
So definitely the cognitive behavioural therapy. So that's something that I've had probably for the past fair few years, different counsellors and things like that. It's probably been the most beneficial. Just being able to as well talk things out and notice kind of the negative spiral that you can go down and things like that as well. Just having someone who's like a positive influence really helps. Just helps in that kind of giving you a bit of self-confidence and things like that.
Okay, great. So it was that sort of relationship that you're able to develop with the counsellor that provided that support, but also sounds like some of the CBT techniques in particular in terms of sort of identifying some of the thoughts and how, you know, in your words can sort of spiral.
Yeah, definitely.
Was a really helpful sort of process in being able to shift those thoughts or that thinking a little bit.
Yeah.
Okay, thank you.
Yeah.
Thank you. So, you know, and again, you've sort of touched on some of these as well, but as a client from a counsellor, were there any sort of professional qualities of the counsellor that were important to you?
I think someone who showed a lot of empathy, and someone who probably is like a warm and relatable. You need to feel really comfortable as well. You know, you're talking about a lot of personal things. So having that feeling of like trust and feeling of that they're sympathetic to kind of what you're going through and things like that. It's definitely some of the qualities that I look for. So
yeah, okay. So in terms of that empathy, someone that's sort of almost there with you, sort of really understanding and feeling how you're feeling.
Yeah, definitely. And just relaying like, oh, you know, that would have been a really bad experience for you, or this kind of thing. So kind of repeating and reaffirming, you know, things that maybe at the time you didn't think were that bad, or, you know, that you've reacted in a certain way. But it's when they're sympathetic, it really helps.
Yeah, and they sort of say, you know, it's okay how you're feeling. And okay.
Definitely,
Okay,
yeah.
And next, sometimes individuals with anxiety will talk about how anxiety has actually helped them in certain ways or has been beneficial. Have you sort of had that experience where anxiety has some sort of unexpected benefits?
Yeah, definitely. I guess, in a weird way. It's definitely helped me gain a lot more like self-confidence over the years because it's made me very self-aware. So self-aware in terms of kind of the mindfulness side of things, and just being able to you know, have a bit of a higher self-esteem and things like that. So it's been
so
surprisingly okay.
So mindfulness is something that was introduced to you during counselling?
Definitely, it was.
Is it something that you still use?
Practice? I do. Yeah. So just probably a regular thing as well. Yeah. And I guess also maybe resilience. So having kind of like a stronger resilience. Just building that up over time. It's, you know, I just think back to if I kind of never got help and kind of, you know, how my reactions would be to situations compared to, you know, what they are now. So, it's helped.
To sort of develop that coping overall, even with sort of new situations that you haven't discussed in counselling, it's sort of almost upskilled you.
Definitely.
For sort of facing new things as well.
Yeah, that's it. Yeah, definitely.
Good. Yeah. So what's it like for you to talk about your experience with mental health?
I was just saying it's a little bit strange because I guess it's something that is quite personal. But kind of having to think about it and things like that, it does bring up a bit of anxiety. But it's that kind of a thing where, you know, you're just like, you know, that's normal because, you know, it's kind of brought up those kind of feelings, you know, that might have not thought about for a while or this kind of thing.
Of course.
But like I think to even be able to talk about it, like I feel pretty lucky to maybe even have a bit of a positive impact on some of the students or things like that, just because it had such a positive impact on me going through that. So it's nice to think at least sharing my story might have a bit of a positive impact for the future. So
well, we certainly appreciate it. So another question that I think might have been sort of one of the ones we'd organised, but I haven't asked yet. Have you, and I'm not sure how many counsellors you've seen, but have you ever had a sort of a less positive experience with a counsellor?
Yeah, I wouldn't say it was just less positive. It wasn't the right fit.
Okay.
So I did see one, and I went and saw her about 2 times.
Okay.
I lived in Sydney at the time, and it just wasn't the right fit in terms of I guess the qualities that we discussed that I was kind of looking for.
Okay.
So perhaps just not feeling comfortable and touching over things that or her plan to kind of what we were going to go through, it wasn't really down the route that I kind of wanted to go down, and I knew that it already what had worked in the past. So,
Okay.
you know, doing things like mindfulness and just different areas like that, I just didn't really feel comfortable with her.
Okay. And was that something that you sort of noticed straight away, that there wasn't a connection, or was it something that sort of, you know, developed, like, you know, throughout that first or second session?
Yeah, to be honest, probably after the first one, I kind of was a bit like, I'm not too sure.
Yeah.
I think she just came across maybe as a little bit more cold, not as kind of sympathetic.
Okay.
And then, kind of said the plan on what we would go on and talk about in the next one, and I kind of thought, I don't really think this is a good fit. Plan to go and see another one.
Yeah.
So,
Okay.
yeah.
So was that something you shared with her?
No, I told the doctor. Yeah,
Okay.
no, that's what I said to the doctor. No, I wouldn't say it to the counsellor.
I was going to say I was very, very impressed.
No,
It can be really
way.
hard
Yeah.
You know, to communicate in that way. But you said to the doctor, and you know, it sounds like you made a really good decision and trusted your own instincts, and you know, and it sounds like as well you were perhaps better able to make that decision because you'd had counsellors in the past and you sort of knew what worked for you and what to expect.
Yeah, that's it. So.
Okay, great, thank you. And, you know, and you might not recall this, but you mentioned as well with this counsellor that there was a sort of plan that you didn't feel like that was the sort of path you wanted to take.
Yeah.
Do you remember what that plan
so a lot of counsellors, I guess in the first few sessions, they kind of go over, you know, what you're going to start with and what you're going to concentrate on. So, you know, we'll concentrate on CBT and, you know, we're going to, you can talk about your history or things like that. But I think she was more so... Yeah, it was just like a lot of, I think it was one of the questions we were going to talk about, but it's just more so in reading a lot of chapters of kind of like a book or something like that.
Okay.
And then kind of coming back with, not really homework, but coming back with doing stuff at home and then bringing it in. And for someone with anxiety as well, I find it like, you know, homework or extra work can be very beneficial, but at a time when sometimes you are very stressed and it's kind of like another thing to add all to the list. And if you already kind of don't have that like connection with someone as well, I just didn't think it was the right route to kind of go down.
Great.
Yeah, if that kind of makes sense.
It makes so much sense, and I'm really pleased that you have raised it as well, because part of our counsellor training is, you know, and these guys haven't yet, but they will do a whole unit on CBT, and of course a big component is homework.
Yeah, it's funny. Like, I think I found it beneficial, and I still did do it with other counsellors. But yeah, sometimes maybe not. In all cases.
And it sounds like counsellors need to be a little bit flexible in terms of working with the client and working out what amount and pace of homework is appropriate. And No, I'm pleased that you raised that, and it's something that has come up in some of the workshops as well, in terms of, you know, it's not as simple as you know, just asking and, you know, explaining certain things and saying, all right, now go and do this. But it's, you know, it's often what clients are asked to do can be really challenging, and as you said before, can be that extra thing amongst a really sort of busy, often stressful life as well. So I'm really
Exactly.
pleased that you've raised that.
Yeah.
Okay. So we might move to some questions. If I'm not sure if you got some ready
Yeah.
there, or did you want me to ask another one while you get
I've
ready?
got,
or
I've got 4 questions.
Excellent. Okay.
And a couple
Great.
of my own.
Great. Okay.
Okay.
Excellent. Yeah.
So should I go with the students' questions first?
Yeah,
Okay.
that would be great.
I'm not sure if you can hear me on your end. Maybe I'll just put my camera on. Yeah, actually, yeah. Maybe there you go. I'm not sure if you can hear me. Students, probably. Okay, great.
Great. Good.
So
good.
we have a question first from Verona, who says, "Hi, Bianca. What did you, actually, I think you've answered this one. Sorry, it's about what you found most helpful. Actually, I think you've answered this one. But then Verona asked another question about what made you search for counsellors versus psychologists or other professionals like a psychiatrist? Or was it you just followed your GP's referral? How did you go about it?
Yeah. So just followed my GP's referral with that one. Yeah, we had a really good family doctor. So I don't know. Yeah, it's mentioned in there. So I had 2 other family members who are bipolar. So we all were kind of treated by the same family one, and we were all kind of quite close, and trusted her judgment to go with that choice.
Mhm.
Yeah.
Okay.
Yeah.
Great. We have another question from Bree. Bree is saying, seeing the counsellor that you didn't work with.
Oh yeah.
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 Was the counsellor not prepared to follow your lead? Did you feel she had her pre-prepared strategies which were not flexible to you?
Yeah.
How did you find it?
Yeah, I mean, yeah, it sounds really bad when I say
No, it
I didn't kind of chose her. But yeah, I think it was a kind of a combination of things. So a combination of, not feeling comfortable, and yeah, for me, having someone who feels a little bit kind of sympathetic, and I'd need to have a little bit more reassurance and that kind of thing. And she did have a pre-planned kind of a strategy, but it just seems very kind of rigid, and I mean, just a little bit kind of strict in terms of if you're already feeling overwhelmed. It's another kind of thing to kind of have to the list, and even though that you do want to get help, it's kind of like you could still go through kind of like a strategy or a plan, but perhaps with someone that was a bit more accommodating and lenient, perhaps just with if you can get this done this week, that would be really great. It will be beneficial to you because of this. But it just came across as a little bit too serious and full on, if that makes sense.
It's almost like
Yeah.
she had her own agenda, and a pre-prepared agenda, as
Yeah.
we mentioned. Thank you.
Yeah.
And before I go on to another student's question, I'm going to ask one that I had myself, because I think it's very relevant to what you just said. So my question was, what was it like for you to change counsellors?
To change counsellors.
Throughout this process, yeah.
Okay. Well, so I've had a fair few now.
Right.
So I've probably had like 5 or 6.
Right.
It was probably I've had a few, mainly due to location changing. So for moving, but to change counsellors, it is a really big thing, because you start and you make a connection, and there's a lot of trust there, and it's something that you kind of work to build that relationship with, and you feel so comfortable with them, and then you have to move or change for whatever reason, or perhaps they've gone on a holiday and you need to see someone else. It is kind of hard. It does get a little bit stressful, I think, as well, in terms of going to a new one, because it's kind of starting all over again.
Yeah.
A whole new kind of connection, personality, and yeah, everyone has their kind of different style too. So yeah,
Yeah.
yeah,
Yeah,
so maybe a bit stressful.
Yeah. So you prefer consistency, if
I
possible.
think
but
so.
yeah, sometimes it's impossible because you have moved, because the counsellors may have moved as well.
Exactly. Yeah. But
Yeah.
consistency, actually, I think it definitely helps.
Yeah. It is
Having
important,
someone.
Yeah. Thank you. I'm gonna
That's okay.
go back into one of. So I have two more questions for students.
Yeah.
From students, sorry. We have one from Alex. Alex is asking: did depression come up during counselling?
Mhm.
Was it an issue? And if so,
Mhm.
did you feel that it was dealt with separately to anxiety?
Yes. Cool. So, I was diagnosed also with mild depression at the time. So I also was put on medication. So it was the kind of thing that was dealt with separately, but then kind of together, because they do overlap in a lot of different ways. So in the counselling sessions, the depression was dealt with in a different kind of way. More the majority than not, like separately, a little bit separately. Yeah.
Okay.
Yeah.
And how was this for you to deal with two issues separately?
Like pretty overwhelming.
Right.
But it was the kind of thing that I think once the anxiety started to improve, the depression lifted.
Oh, okay.
So I think it was this kind of a thing that it kind of felt as though that anxiety it made the depression kind of a lot worse. And I think a lot of it as well is just kind of from feeling a bit stuck, and that you're just going to feel this way, not going to feel kind of like normal. So yeah.
Okay. It's good to hear that the kind of once one of the issues started to ameliorate, then the other one also started to improve.
Yeah.
We have a last question from a student, then I've got another one from my own, actually. For myself. So Verona is asking again, did dealing with or being diagnosed with anxiety change how you saw yourself? And if so, how?
It definitely did. It kind of, it was bizarre because I felt, like I mentioned, it was some kind of a embarrassment or shame to see a counsellor, like, that I was kind of too weak to deal with, these issues that other people are fine with. Like, so in having, I guess, like that label, I found it was kind of embarrassing in that I didn't really tell anybody for a long time, and I think though in the end it does it helps having kind of something that explains why you feel the way you do. So for so long having really bad anxiety, and then not even knowing what it was. So it really helped when you kind of had a name put to what you're going through. That really did help. But yeah, at the time, it it wasn't a very nice thing to kind of go through. But over the years, I kind of thought, no, this is a legitimate disorder. It's something that I have medication and I have counselling to better myself, and it's I think in that after probably like growing up a little bit, because you're a teenager as well at that time, so finding out that did help in the end.
Yeah, and we often talk in the lectures and the workshops and with clients as well about normalizing the experience.
Exactly.
And labeling it something, it helps not only the clinician to develop a more individualized and evidence-based treatment plan, it also helps the client to feel more normalized, and that it's something that is common out there.
Yeah. Oh,
Yeah.
definitely.
Yeah.
Yeah.
And I often say to clients, when I normalize something, I try not to over normalize it, not to dismiss the experience. Oh, yeah, it's too common. Yeah, usually, over normalizing something may dismiss the experience a little bit.
Yes.
Thanks, Bianca. I've got actually, the more we talk, the more questions I come up with.
I have a couple more too.
Okay, okay. I've got actually two that I've got on my end.
Yeah.
Do you want to ask your own, Hayley, and then we'll come
Okay.
back? Okay.
Okay.
Sure.
Okay. Okay. So, just where you sort of left off as well, Bianca, you spoke about your age when you first experienced these symptoms and started with counselling.
Yeah.
And I was just wondering, how involved were your parents with that process?
Yeah.
And given you're at school at that age, I was also interested in whether or not your school or teachers were involved as well.
Yeah. So I guess it was a hard one at the time. So my mum was going through manic depressive disorder or like bipolar, but it was around that time, everything was kind of a bit flared up in a lot of situational things that kind of happened. So in kind of her state, I understand that she couldn't kind of handle what was going on with me plus herself, if that kind of makes sense.
Okay.
So she kind of directed me to the doctor and the counsellor, but I think, I think it was just probably a lot for her to kind of deal with. So in that way, just even, kind of touching on it, what anxiety is and that kind of thing with me really helped, and kind of talking a bit about it, but then saying, to talk to the family doctor and she would go through it. And that's when the family doctor kind of came in and, talked really thoroughly with me about it.
Okay.
And also about, just the effects as well that other disorders have on what they're going through and things like that too.
Okay.
So kind of out of the whole situation, my dad was probably the one that was very supportive, as he could be. So like I said, that day, I had the day off school because it was just all too much, and he took me like to the beach, and he's like, life's, it's fine, like, we just have a day of relaxing by the beach, nothing bad is going to happen, because so it's just these constant thoughts of worry and fear and things like that. So I think for him it was like, this might be able to help you kind of for the day, so a bit of understanding in that way. So then at school, I none of the teachers, I guess, really knew. So I did have various like sick days, but these were all covered by the doctor. So the doctor, they can write their doctor certificate of, obviously if it's like related, mental health related, they can write it. You have to have a certain day off school, and not even really have to touch on why.
Okay.
So a lot of the teachers didn't know, but I did see a school counsellor as well.
Okay.
And they were quite helpful as well,
Yeah.
and more kind of school oriented
Okay.
speaking,
Yeah.
and how to deal with kind of like, school stress.
School stress. Okay.
And that kind of thing.
Yeah. Okay.
Yeah, so
Okay.
that was good.
Yeah.
Yeah, very helpful. Yeah.
So it sounds like you were perhaps able to hide that anxiety quite well when at school.
Definitely.
In terms of the teachers or other adults or even friends not necessarily being able to see what was going on inside.
Yeah.
Yeah. Okay.
Yeah.
Thank you.
Yeah, that's okay.
We're sort of sharing, aren't we, Lecterate?
That's okay.
And we might have a couple of other questions from students as well, so I'll let you jump over.
Sure. Before I ask you another question that just came through from Alex, I'm going to ask you the one that I had in mind before, because I think it's very related to what you just discussed with Hayley.
Yeah.
So you mentioned about dealing with anxiety while you were a teenager and how family was involved.
Yeah.
Would you say that your needs from counselling have changed over time? So since you started when you were 15 to now?
Yeah.
And if so, how?
definitely have changed. I think from the impact of that self-management and being able to deal with it a lot has changed things, but also situational. So moving out of home. So like for me personally, that ended up being a huge difference, and that there was a lot of anxiety associated with that environment. So you know, obviously, living with two other family members with mental health issues, you know, at the time it's kind of like, oh, you know, this is just kind of how it is, and then kind of moving away from kind of a stressful environment. It just really helped. So over the years, I've found that even the things that I would talk about with a counsellor, you know, it all definitely has changed. So just, you know, even different issues and things like that, because, you know, I've already kind of learnt different ways to manage. So it's more so maybe just touching on maybe bigger events that have happened, and that it's kind of situational. That I find you know, big issues come up, and you chat about them. You know, like a relationship breakup or a big job change or these kind of things. They're the things that would prompt kind of a need to see someone constantly. But other than that, it's there's kind of a bigger time now for me to go and chat to one.
Okay.
Yeah. So less frequent.
Yeah, less frequent.
That
Okay.
makes sense.
Thanks.
Yes.
Thanks, Bianca. This actually makes me want to ask also, you said that you mentioned that you've been quite open about your other family members' mental health issues.
Yeah.
How does others' anxiety or others' mental health issues impact on yours? So, for instance, with anxiety, when you are near someone who is anxious, does it impact on your own anxiety levels at all?
No, I don't. Oh, okay, wait, to a degree. So, I guess if I was around friends or even strangers, perhaps who were going through anxiety, that wouldn't make me anxious. So I would kind of try and help them maybe go through whatever they're talking about or feeling anxious about with my experience, to try and help them. But in terms of if it was being around family members that are going through anxiety, then that definitely heightens my own anxiety.
Okay, thanks. So I'm glad you mentioned experience, because you're talking from experience here as well.
Yeah. So like, you know, now it's kind of it's fine. So yeah.
That's fine. One question that came from Alex says, Bianca, do you think things have changed since you were 15? So, for instance, do you think there is less stigma now and fear of seeming weak, or is it still a big factor, you think?
I think it's all definitely changed. So I think what you mentioned with that whole normalizing and things like that, I think in kind of like the media, you know, you're hearing a lot more, you know, issues about football players having depression, about celebrities having anxiety. So it's something that it's kind of coming more into the public eye, which in turn, you know, it as well affects how other people react, I think, as well. I think it's definitely changed. I think there's a more kind of positive light in terms of recognition of what it is. So yeah, I think when I was younger, you know, perhaps I thought that I was weak at the time though, because I didn't really know what it was, and it was kind of high school, and you know, like I said, I felt kind of ashamed and things like that. Whereas I think the perception's changed, but I think also my own mentality has changed about it too.
Okay.
I hope that answers the question.
Sounds like it's a positive change, yes.
Yeah.
And it might have to do also, tell me if I'm wrong, with where you were living before as opposed
Yes.
to where you live now?
Yes, yeah. So yeah, because of a lot of changes too. Yeah.
Yeah, like smaller community going to a big community. Yeah.
Yeah,
Yeah.
definitely. Yeah.
So Bree is asking a question, saying, in hindsight, do you think if you had told your school teachers
Yeah.
that you would have had additional support, or that you would have created more anxiety, that more people knew about the anxiety?
Yeah, I think they're more so creating more anxiety for myself.
Yeah, okay.
That other people would know that, you know, there was something kind of like wrong with me or this kind of thing. I mean, you know, that being said, even during the HSC, I did let a teacher know kind of just before the end. So we were coming up to a time with a lot of assignments, and I was just so, you know, anxious and really bad. And I actually did tell him right at the end, and completely understanding, sat down with me, and he's like, okay, what do you need to do? Let's flesh this out, and this is what you're going to do. Spend your time on this, and just really supportive experience. But I think, you know, perhaps a few years, a few years before that, if I did that, I don't think I would have been able to kind of handle just that anxious feeling of, oh my gosh, you know, what are they going to say? What are they going to think? But a few years on, after a little bit of counselling and acceptance and more feeling a bit more positive, that's when I kind of said to one of the teachers. But I still didn't tell any others, and it was still kind of right at the end of around that the end of the high school period, when all your assignments and everything's due.
Yeah.
So, yeah.
Okay, that's very insightful. Thanks, Bianca.
Yeah, it's okay.
Davina is asking the last question that is coming from students, saying, do you see generalized anxiety disorder as a permanent issue or something that can change over time?
Yeah, that's a really good one. I think it's something that can change over time. And I've had a lot of different input from different doctors and counsellors. So, like, I've also been on a medication for like 15 years. You know, some people, doctors and counsellors say you can come off this at some point in your life. But you need to be in a good mindset and a good time for 6 months, and we need to monitor that. And I haven't been able to get to that point, even with great counselling and things like that. So I think it's kind of something that I feel like I will have, because I kind of have had my whole life. So I feel as though I will have it, and it's just that kind of self-managing, and yeah, eventually, you know, who knows, I might come off medication, but I would still, you know, see a counsellor and still have that additional support in place. But yeah, I think it would be something that unfortunately, I guess I will probably have my whole life. So yeah.
Okay.
Yeah, and it sounds like there's been some sort of common symptoms that have been there and may continue to be there, but also sounds like how you are able to notice those symptoms and manage and act has sort of changed over that time with how much sort of hard work you've done and all the counselling and all the acceptance and self-awareness and all the rest.
Yeah, exactly. I think if I really probably put, maybe not effort, but maybe dedicate that, 6 months to just really, perhaps seeing a counsellor very constantly, and, making sure I'm in kind of like a stable work situation and things like that. But, it's a hard one.
But you've got the supports and the options and...
Exactly.
Okay, thank you.
Yeah.
So it looks like is there 2 more questions?
From me.
Oh, all right. The last.
Unless you have your own.
You're a question hog.
No, I was just no. You're very welcome. I was just thinking it might be nice for Bianca to finish on any advice that she might have for students as they begin and progress through their counselling careers. But there's a couple of minutes, so if you wanted to, I'm sure.
just a very brief question I wanted to ask, and feel free to indeed be very brief with this, is when you feel anxiety flaring up, for whatever reason, do you have any quick strategies to just that you can quickly resort to help you manage it just temporarily?
Yes,
What are
yes.
these?
So this has actually come up a lot, which is, what I found is first I'll reach out to support, so like to a friend, and I'll say like it happened, I don't know, a few months ago at a conference I was at, and I was meant to go out and socialise and network after, and I was like, I can't do this, and they said her advice, because they know, is like, it'll be all okay, take 5 minutes, go to the bathroom, and just breathe and concentrate on your breathing. So it's kind of like a meditation. So for me, that's kind of my go-to. Concentrate on that really deep breathing technique, and that usually works. So yeah, that's my go-to thing.
Great response and great question.
Yeah.
Thank you. So shall we? Yeah. So again, we've only got a couple of minutes. So again, thank you so much for your time, Bianca.
That's okay.
I really look forward to actually hearing feedback from the students. But I'm sure they found it incredibly helpful.
Oh, cool.
So just
That's
as a
good.
sort of ending point, these guys are so they're doing their masters of counselling. Some are in their first year, some are in their second year.
Cool.
So just wondering if you had any advice or guidance for them as they begin their careers or progress through.
I just am, it's good on you that you're going to really be helping people, with what they're going through. That's kind of one of the reasons that I was like, I want to come and help, because it's been such a positive impact in my life, to be honest. So I guess to have that in mind, that you have that power, like, to really impact somebody's life, in helping them be able to manage what they're going through in a better way. For me, I just found for my personal qualities of finding someone who is very sympathetic and trustworthy and things like that, I'd assume that a lot of other patients would be looking for similar. So I think that's something that you would probably work on, and just kind of being warm to your patients. That's definitely.
Wonderful. Thank you. Thank you so much. And I hope that's been helpful for students as well, and especially around just how helpful it's been for you. They've actually got an assignment due at the end of the week, so that might help with a little bit of motivation. That, there is light at the end of the tunnel.
Oh, definitely.
So thank you again so much, and thanks Lefteris for looking at the student questions, and thanks guys for tuning in. So I'll end the lecture there, but again, the students are just saying thank you to you there as well. So so thank you so much, and we'll see you guys next week. All right, thanks very much.